Good evening. My name is Chanel Ascar, and today I have the honor and privilege to be talking about Costello syndrome. And the reason why I chose this syndrome is because I am an LVN, a licensed vocational nurse, and I take care of an 8-year-old girl that is diagnosed with Costello syndrome. So here it goes. Here is a picture of Janie, which is her name. What is Costello syndrome? Now, Costello syndrome is an extremely rare genetic disorder, so rare that it affects 200 to 300 people worldwide. In fact, as of August 18, 2020, reports have estimated a range from 1 in 300,000 to 1 in 1.25 million people that are diagnosed worldwide. All the rest of the cases remain undiagnosed and just are unknown. It is also known as faciocutaneous skeletal syndrome, or FCS, and involves delayed physical and mental development and affects a range of bodily systems. Here's another picture of my patient, and this is on the bus when she's in her wheelchair and I'm right beside her in case anything happens. Who discovered Costello syndrome? So, in 1971, a pediatrician from New Zealand named Dr. Jack Costello identified a relationship between two children that had intellectual disabilities, poor growth, similar facial appearances, and wart like growths. So, here's a picture of Dr. Jack Costello. So, Dr. Jack made these findings in 1971, and the appearances the facial appearances he saw in these children were similar to what I just showed you of Janie, like the wide nostrils, the more older looking facial appearance for a young kid. And he published his findings in his New Zealand medical journal. And he published that in 1977, but he founded it in 1971. And nearly 20 years later, when the disorder was well known as Costello syndrome, he wrote about these two patients in a follow-up that added a list of these symptoms: high blood pressure, breast fibroadenoma, and skeletal complications including scoliosis and tight Achilles tendons. And he wrote about this in 2005. And in 2005, this is when the genetic mutation that caused Costello syndrome was identified. And this is a gene called HRAS. So when this gene is mutated, that is when Costello is identified. And sure enough, Costello syndrome was named right after Dr. Jack Costello. These signs and symptoms, there are quite a few. So there is wide nostrils, failure to thrive, trouble feeding, skin tags or warts. So these skin tags and warts can be found anywhere, and they can be cancerous or non-cancerous, benign or malignant. Scoliosis or kyphosis. Scoliosis and kyphosis are curvatures of the spine. Scoliosis is more of an S shape, and kyphosis is more just curved in. This is found in elderly. Short stature and slow growth. So they have a hard time, or their size and their height are not matched with the age that they are at. And then intellectual disability, also known as ID, developmental delay, which is why most Costello syndrome children are placed in special education, a large head or macrocephaly, low ears, thick earlobes, hyperextensible joints, a large mouth, squinting, loose skin, especially on the hands and feet, and heart problems and dental issues, thick calluses and toenails, and a higher risk for tumors, either benign or malignant. So most of the signs of Costello syndrome are not noticeable at birth, but they appear as a child starts to grow. Their birth weight is usually normal, but a little bit above average, but the infant will grow way more slowly than most children, unfortunately. So here I added a picture of Jeannie's loose feet, loose skin on her feet, sorry. And here's another picture of her delayed development. So she is required to wear braces on her legs. And here's another picture of the loose skin on her hands. They're highly distinctive. And then in this last picture, it shows her squinting, her wide nostrils, her big mouth, and her dental issues. You can tell that she has a few missing teeth, and her loose skin on um, her hands, and then a larger head. And also, you can see that she's failing to thrive, and I am feeding her through a G tube because of her feeding disorder. What are the causes of Costello? So, like I said, it is caused by a mutation in the HRAS gene. This is in 2005 when they discovered this. It is inherited as an autosomal dominant genetic condition. So, this is when one of the parents is affected. Then there is a 50% probability that one of their children will be affected with Costello. The HRAS gene mutations that occur causes cell to grow and divide all the time. So it's constantly growing and dividing and multiplying, the mutations in the HRAS gene. So this is why people with Costello syndrome are prone to developing cancer. So this is why my patient does get tested for cancer. Like, she has a wart on her chin that she does get tested for. Here is just a photo of the HRAS gene that is identified for Costello syndrome. It's the yellow one circled. The other ones are for other syndromes. I believe for Noonan syndrome, the NRAS, and the KRAS is for another one I cannot remember. And in this photo, I'm just showing that if one parent is affected, then there's a 50% probability that the son or daughter will be affected as well. And that's what makes the autosomal dominant gene. The pathophysiology of Costello is that it consists of congenital abnormalities of the heart, craniofacial features such as a large head, prone to developing tumors, eye and vision changes, including rapid eye movement, shortness of breath, difficulty airway, and a feeding disorder leading to failure to thrive. So the pathophysiology happens because the HRAS gene mutation affects the production of elastic fibers in tissues. They are very vital, like tissues are the fibers are vital to structures such as the lungs, skin, and large blood vessels, including the aorta. These fibers are important for keeping our hair and skin strong and preventing early breakage and for maintaining the integrity and strength of blood vessels and our lung tissue. So, because of uh, the mutation in the HRAS gene uh, affecting the production of a healthy lung tissue, someone with Costello syndrome has shortness of breath and difficulty airway. So that's why Jeannie has a lot of mucus production in her lungs that she's not able to cough up. However, she is progressing and she may get her trach moved out soon, so that's great. And just a fun fact, most cases of Costello stem from new mutations, and there's no family history of the condition, or there can be a case with no family history. Also, prone to developing the tumors, the HRS gene does belong to a class of genes known as the oncogenes. Oncology does mean the study of cancer, so this is oncogenes, which is similar to cancerous mutations. So this is why when when the oncogenes are mutated, there's a potential to cause a normal cell to become cancerous. So I don't know if that makes sense for you. So the increased incidence of the congenital abnormalities of the heart, they are determined by abnormal heart sounds like heart murmurs, structural malformations, abnormal thickening of the muscle walls of the left lower chamber of the heart. This is called cardiomyopathy. The leakage of the valves between the upper atrial and the lower ventricle heart chambers, chest pain, arrhythmias. And for the eye vision changes and the rapid eye movement. Janie constantly has rapid eye movement, so which is why she does wear glasses to maintain her vision. Feeding disorders leading to failure to thrive. Uh, Most children with Costello syndrome have a feeding tube, either nasogastric or G tube. She has a G tube, and it's by bolus and not through through a continuous feeding through a machine. So I do it by hand through gravity. And um, this is placed during their first months of life. And since GERD or gastroesophageal reflux also might be a big problem for patients with Costello, some of them have to undergo a surgical procedure in order to improve that situation. After the feeding tube placement is there, children may gain weight sufficiently, although some of them suffer from severe side effects like vomiting, retching, gagging, poor tolerance of the tube feeds. This might lead to persistent growth retardation. So here's a photo or many photos of me suctioning Janie's trach tube, and hers is capped. It does not need to be connected to a ventilator or breathalyzer or anything like that. She is not dependent on oxygen, which is great. So she is just needed for suctioning when I can notice that her mucus is unable to come up on her own and she can't cough it out on her own. I can tell when it's time to like suction and get that extra mucus accumulated in the lungs. So that's her trach. It's capped. The wart on her chin, if you notice there, uh, that is what I was talking about for the wart-like growths that can be tested for cancer or not. There's her Mickey G tube on her stomach right there. There's me with her solution and doing a bolus feeding. That's through gravity. The higher you go up, the faster it goes down into her stomach. There's another picture just to show a better visual without the solution in. And here's just another fun picture of Janie and I. How is Costello diagnosed? So now with all the tools and technology and nowadays, doctors perform clinical examinations and specific diagnostic criteria for this syndrome. The molecular genetic testing is important because that's when they find the mutations in the HRAS gene to determine if the patient has Costello. The doctors also ask questions about symptoms and medical history. MRIs are done, or magnetic resonance imaging, ultrasound scans, and echocardiograms, or ECGs. So in this picture, I'm showing what an ECG is. It's basically scanning the heart, and a printout comes out, and the doctor is able to determine any abnormalities in the beats or anything like that. There's the MRI, magnetic resonance imaging. This is when a patient goes into a full body scan and no jewelry is allowed because it's magnetic. So there would be a problem there if you were to go in with jewelry on. Okay. So treatment and management. So unfortunately, there is no cure for Costello syndrome. Basically, the symptoms are what is treated. So that's like the cardiac abnormalities. The delayed development is cured with bracing, or not cured, but just managed better. Uh, a lot of therapies with occupational therapists, physical therapists, and speech therapists. So they are also intellectually disabled. So this is why they need a speech therapist, because they are behind in their communication skills. And with speech therapy, they're able to work on their speech. And Janie communicates with me with sign language, which is great. And she also has an iPad that she tells me what she wants and how she likes something or how she feels, which is amazing actually. Like technology is used to its fullest with this. And so basically, treatment is toward these specific symptoms, like I said, with the work of a team of pediatricians, physicians, cardiologists, orthopedists, dermatologists. So the dermatologists are for the skin, and they can determine the biopsy and see if something's cancerous or not cancerous. She also sees doctors for her bladder, anything like that, to see if she has bladder cancer, and mainly the orthopedist. Though that's for when she's determined to wear braces for her legs so that she's stabilized. Also, with her cardiac abnormalities, these are treated with beta blockers or calcium channel blockers for the heart. Here's just a few pictures that I'm sharing during Janie's occupational therapy sessions. And here you can see that she is practicing drawing her E's in her name. And then she's also trying to cut a piece of paper. So these types of therapy sessions really focus on her motor skills, and it's all about muscle memory. So it really does help her repetitively once a week. And to the right hand side, I have a video of Jeannie walking with her braces. Okay. So the prognosis of Costello syndrome, it is a lifelong condition. However, life expectancy just really depends on how severe the the symptoms are. Like, for example, the heart defects and any medical complications that come with the syndrome. So, depending on how severe those are, is when it makes your life expectancy shorter, unfortunately. So, studies haven't really shown an exact age or how many months they have to live after they're born or anything like that. That's why the doctor's goals are to help with the symptoms as much as they can, help prevent it and catch anything early on so that they can treat it. So, additional research about Costello that I found that I thought was pretty interesting is that back in 2008, Spanish, Italian, and Japanese researchers they used the G12V mutation, and they discovered zebrafish and mouse that had Costello syndrome with this mutation. So I thought that was pretty cool. It's not just in humans; it was also found in zebrafish and mouse or mice. Okay, and I believe that does conclude my presentation. Here are my references that I used about this syndrome. And I am very, very honored. And the feeling is so rewarding to be able to know about this rare disease that most people do not know about, not even doctors, nurses, anyone in the medical field. And I didn't even know about it or learned about it in school when I was going to nursing school. So I really hope that you do take this information, pass it along to your future classes, and yeah, and just I hope you learned something from it. And this last slide, I did add a video of Janie. I just thought that she should be included in some way, and she was pretty excited. So there we go. Let's play it. And that finalizes my presentation. I hope you enjoyed and learned a lot. I have the honor to take care of Janie. And that is it. Any last words, Janie? Okay. Now say bye and give a thumbs up. Thumbs up. Say bye. Say bye, everyone. Alrighty, and if you have any questions, comments, or concerns, please feel free to email me, and I'd be more than happy to answer more further questions. Thank you so much.